There are lots of different hip pathologies that we can see and treat in our practice. At any age in childhood, even into young adulthood, we may deal with hip dysplasia, which is a hip that's a little underdeveloped. Sometimes it's even dislocated where the ball and socket joint is separated. In the mid-childhood phase, we may see another condition called leg calf Perthes disease, which is rare but can lead to deformity and requires longitudinal treatment and may not require surgery in the beginning, but may require surgery later to treat it. In young adolescents, we see a deformity called slip capital femoral epiphysis, which usually requires surgery right away and sometimes reconstruction later. We see problems with infections in hips all throughout childhood, and that's one of the leading reasons that kids may come into our emergency department at RWJBarnabas hospitals, and those kids will come to our center for treatment. And then another area of interest that we see in our athletic population is hip impingement, where the hip is a little bit over-constrained and doesn't move well. But at whatever age children present with these problems, we have diagnostic tools, we have wonderful imaging, and we have surgical treatments ranging from arthroscopy to osteotomies that can occur both on the femoral side and on the pelvic side to reconstruct the hip joint on both sides to help correct these complex deformities. And we treat children from all over the world for this. The causes of hip pathology can range from developmental problems that occur simply because of how our hips are forming and growing. There are problems that occur because of trauma. We see children that come in that dislocate their hip in a bike accident or a sporting accident, and we have to reconstruct their hip from that. Infections can occur spontaneously without much warning beforehand, and those we want to react to quickly to prevent a child from getting sick and septic. So a wide range of causes can lead to having to treat these hip problems that we see coming in through our system.